We are often told breastfeeding is natural. It is instinctive. It is something that should come easily to both mother and baby. Mothers and babies are biologically designed for this. Their bodies are equipped for this beautiful process. While biologically true, this narrative can be misleading. It paints a picture that doesn't always match reality. It sets unrealistic expectations for new mothers. They may feel unprepared for the challenges they face. Breastfeeding, for many, is not inherently easy. It can be a struggle, filled with pain and frustration. The reality is more complex. Many mothers face hurdles. These hurdles can be daunting and disheartening. These hurdles can be physical. They can be emotional. They can be logistical. Each mother's journey is unique. The myth of effortless breastfeeding creates pressure. It can make mothers feel like they are failing. Mothers may feel inadequate if they struggle. They may feel isolated in their experience. They may feel like failures. This can lead to feelings of depression and anxiety. This is far from the truth. Struggling with breastfeeding does not make a mother a failure. It is crucial to acknowledge the challenges. Recognizing these challenges is the first step to overcoming them. Breastfeeding is a learned skill. It requires practice, patience, and perseverance. It takes time, patience, and often support. With the right help and resources, many mothers can find their way. One of the first hurdles new parents face is achieving a good latch. This is often easier said than done. A proper latch is crucial for comfortable and effective breastfeeding. Without it, both mother and baby can face numerous challenges. The baby needs to latch onto the breast deeply, ensuring they can draw out enough milk. This deep latch ensures they receive enough milk, which is vital for their growth and development. However, achieving this can be tricky and frustrating for many mothers. Some babies struggle to latch correctly, which can be disheartening. This can be due to various factors. These include tongue tie, palate issues, or simply being premature. Each of these conditions presents its own set of challenges. A poor latch can be painful for the mother, causing significant discomfort. It can lead to sore nipples, cracked skin, and even bleeding, making the breastfeeding experience quite distressing. This pain can make breastfeeding unbearable, leading some mothers to consider alternative feeding methods. When a baby doesn't latch well, they may not get enough milk, which can be concerning for parents. This can lead to weight loss, dehydration, and other health concerns. It's important to seek help early to address these issues and ensure both mother and baby are healthy and happy. Another common concern is milk supply. Many mothers worry about producing enough milk. This worry is often unfounded, but not always. Several factors can influence milk production. These include stress, fatigue, and certain medical conditions. Sometimes a mother's body may not produce enough milk. Insufficient milk supply can be distressing. It can lead to feelings of inadequacy and failure. It can also impact the baby's growth and development. If a mother is concerned about her milk supply, seeking help is crucial. Lactation consultants can offer guidance and support. Breastfeeding is often romanticized as a beautiful bonding experience. While it can also be physically demanding. Many mothers experience discomfort. Sore nipples, engorgement, and mastitis are common. These conditions can make breastfeeding painful. Engorgement occurs when breasts become overly full of milk. This can cause swelling, pain, and tenderness. Mastitis is an infection of the breast tissue. It can cause fever, chills, and flu-like symptoms. These physical challenges can impact a mother's well-being. They can make breastfeeding feel like a chore rather than a joy. Section 5. Emotional roller coaster, the invisible struggle. Beyond the physical challenges, breastfeeding can take an emotional toll. Hormonal fluctuations after childbirth can intensify emotions. Mothers may experience anxiety, exhaustion, and even postpartum depression. These emotional states can impact their ability to breastfeed successfully. The pressure to breastfeed can exacerbate these emotions. Mothers may feel like they are failing if they struggle. They may feel guilty if they choose to supplement or stop breastfeeding altogether. It's crucial to remember that a mother's emotional well-being is paramount. Her mental health is as important as her physical health. Section 6. Societal pressures. Exacerbating the challenge. Societal expectations can add another layer of complexity. The breast is best campaign, while well-intentioned, can put undue pressure on mothers. Mothers may feel judged for their feeding choices. They may face criticism or unsolicited advice. This pressure can make an already challenging experience even more daunting. It is essential to remember that every mother's journey is unique. There is no one-size-fits-all approach to infant feeding. The decision of how to feed a baby is personal. It should be made by the mother, in consultation with her healthcare provider. Section 7. Seeking support, a sign of strength, not weakness. Given these challenges, seeking support is crucial. Many resources are available for breastfeeding mothers. Lactation consultants are trained professionals. They specialize in helping mothers with breastfeeding challenges. They can provide guidance on latch, positioning, and milk supply. Support groups can also be invaluable. Connecting with other breastfeeding mothers can provide a sense of community. It can help mothers feel less alone in their struggles. Seeking help is not a sign of weakness. It is a sign of strength. It shows a commitment to providing the best possible nourishment for the baby. Section 8. Expert voices, validating the struggle. Experts in the field of lactation emphasize the importance of support. They acknowledge that breastfeeding does not always come naturally. Breastfeeding is a learned art, says leading lactation consultant Jan Barger. It takes time, practice, and patience. Renowned pediatrician Dr. Jack Newman echoes this sentiment. Many mothers need help to breastfeed successfully, he states. It is not a sign of failure to seek assistance. These expert voices validate the struggles many mothers face. They highlight the importance of seeking help when needed. Section 9. Embracing the journey, support paves the way. Breastfeeding can be a beautiful experience, but it is not always easy. It often requires patience, practice, and perseverance. It is essential to debunk the myth that it comes naturally to all mothers. Many mothers face challenges, and that's perfectly normal. These challenges can be physical, emotional, or logistical. Physical issues might include latching problems or low milk supply. Seeking support is crucial for overcoming these hurdles. Emotional support from family, friends, and professionals can make a significant difference. Remember, every mother's journey is unique. What works for one may not work for another, and that's okay. There is no right or wrong way to feed a baby. The key is to find what works best for both the mother and the baby. The most important thing is to nourish the baby with love and care. This bond is what truly matters. Whether a mother chooses to breastfeed, formula feed, or a combination of both, support is paramount. Each method has its own set of challenges and rewards. By embracing the journey and seeking help when needed, mothers can navigate the challenges of infant feeding with greater confidence and success. Support groups, lactation consultants, and understanding partners can all play a vital role in this journey.